Hello, everyone, and welcome from North Carolina for our conversation with Dr. Sue Hassmiller on the National Academy of Medicine report, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. I'm really excited that you, the audience, has joined us today for this important discussion. The goal of our time with Dr. Hassmiller is to learn more about the report and to envision together the pathway into the future for nursing. I wanted to just give you a few housekeeping tips so that you'll have the full knowledge of how we'll run this, the event. We're recording this event, and anyone registered will receive a link afterwards. We ask that you please mute yourselves. If we notice someone becomes unmuted during the event, we will likely mute you just to keep the noise down. We'd like to ask that you please enter your questions in the chat box. Those questions will be sent directly to me, if you will. I'm Cheryl Jones, the host, and I will monitor and read questions during the Q&A portion of the event as time permits. I encourage you to reflect on and write down your thoughts during Dr. Hassmiller's remarks. Think about what resonates most with you. I also encourage you to think of ways you can bring attention to the report findings in your workplace. And finally, think about how you can take steps to implement or to help implement in small and large ways the recommendations from this report in your everyday work and lives. I have to give a shout out to just a few people because it's really important to do so. First, Ms. Andrea Cummings, our School of Nursing event coordinator. I have to say, you're the event coordinator and so much more, Andrea. Thank you very much for all of your help. I thank also Mariah Keller, our Director of Communications, and Robin King, the Executive Assistant to the Dean, who all together helped us on this, orchestrate this event. Now I will introduce Dr. Hassmiller, and then I'll turn it over to our Dean, Nina Paragala-Montano, for a few remarks. First, Dr. Sue Hassmiller is the Senior Advisor for Nursing and the Scholar in Residence at the National Academy of Medicine. She's been in that role from January 2019 through August 2021. In this role, she serves as a key member of the leadership team for this very report, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity, that was recently released last week. I know everyone probably has it in hand. She is also the Robert Wood Johnson Foundation Senior Advisor for Nursing, and in partnership with AARP, she directs the Foundation's Future of Nursing Campaign for Action. This national initiative advances the recommendations of the IOM report, The Future of Nursing, Leading Change, Advancing Health. Dr. Hassmiller has served as the report study director. She has also worked across many different settings, particularly in public health settings at local, state, and national levels, including the Health Resources and Services Administration. Dr. Hassmiller taught nursing at the University of Nebraska and George Mason. Dr. Hassmiller is an elected member of the National Academy of Medicine, a fellow in the American Academy of Nursing, and sits on several advisory committees and boards, including the Hackensack Meridian Health System, United Health, Carrier Clinic, Nurses Everywhere, and the American Red Cross. And we're particularly excited that she was a recipient of the Florence Nightingale Medal, the highest international honor given to a nurse by the International Committee of the Red Cross. And now I'll turn over the floor to the Dean of the School of Nursing at the University of North Carolina, Chapel Hill, Dean Paragala-Montano. And I'll just say she's the 7th dean of our school, and we welcome her to give a few remarks today. Thank you.
Thank you, Cheryl. Thank you so much, and I'm thrilled to see so many of you that could join us today. As many of you already know, the first Future of Nursing report was released in 2011, and made clear recommendations for nurses to become leaders for change and improving health for all. This new committee has extended the work into 2030 and beyond in this new report, The Future of Nursing 2020-2030, Charting a Path to Health Equity. The committee's full report, like Cheryl says, was released last week on May 11th. This report charts a new path for nursing to help our nation create a culture of health, reduce health disparities, and improve the health and well-being of the US population in the 21st century. The timing of this report could not have been more fitting. As you all know, this has been a critical time for nursing, filled with great opportunities and also challenges. The COVID-19 pandemic has driven nursing to the forefront of global awareness, showing us the crucial role that nurses play in keeping us healthy and safe. Nurses have been at the forefront of caring of patients and families while bringing innovations to the field through new practices and technologies such as telehealth. However, we are also hearing concerns about the nursing shortages and patients' lack of access to care. And we're living during a time in our nation's history that is profound and marked by both human tragedy through racial injustices and by human kindness. In this, there is great opportunity for nursing to make a difference if we're willing to be bold and courageous. The timing of this Future of Nursing report is essential to guide our path forward in nursing. It includes emerging evidence related to the COVID-19 pandemic and presents recommendations regarding the essential role of nurses in responding to the crisis created by a pandemic. So I'm so pleased that Sue Hassmiller has joined us for this conversation today. Sue is a longtime friend of Carolina Nursing and currently serves in our Board of Visitors. She will first discuss the committee's recommendations for the future decade of nursing, and then we will open the conversation for questions from all of you. Thank you for being with us today, Sue. Thank you.
Thank you. I'm going to apologize ahead of time. I just had some, this is the wonderful thing about doing this from home, but also I have some workmen here. So I just heard a big bang upstairs. So I apologize if you hear any other bangs, but I'm not going to have a dog barking. So thank you, Dean. I'm so grateful to be here. And I'm also grateful to Cheryl for her leadership in education, nursing now, and inviting me to be with you all this afternoon. Thanks to each of you for your dedication and commitment to nursing, whether it's serving on the front lines, teaching the next generation of nursing leaders and researchers, conducting research, or preparing to enter the nursing field. I'm thrilled now to present to you the findings from the new National Academy of Medicine report, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. The report arrives at an inflection point for the nursing profession, so important this timing. The past year has increased our visibility, but it's come at a great cost. Nurses are emotionally spent from caring for COVID patients. The pandemic has also laid bare, as we all know, the stark inequities that have persisted across generations. The decade ahead will demand a stronger, more diversified nursing workforce that is prepared to provide care, promote health and well-being among nurses, individuals, and communities, and address systemic inequities that have fueled wide and persistent health disparities in our country. The University of North Carolina will help to usher in that future. The report is aspirational and ambitious, and I'm incredibly proud of the committee that oversaw the creation of the report, led by Drs. David Williams and Mary Wakefield. And it recognizes that nurses can play a central role in advancing health equity while acknowledging that nurses need robust education, supportive work environments, and autonomy to do this work. The future of nursing during the next 10 years will be about creating a more fair and just world for everyone. And all of you will be helping to create that world. Next slide, please. The This report is the second major report released by the National Academy of Medicine on the future of nursing. The first report, hopefully everybody remembers that, The Future of Nursing, Leading Change, Advancing Health, was released in 2011, and I was the study director for that report at the time. It reconceptualized the role of nurses in transforming the healthcare system. The Robert Wood Johnson Foundation and AARP then formed the Future of Nursing Campaign for Action, a nationwide initiative to advance the report recommendations. The nursing field, including many of you, mobilized to strengthen nursing education, advance practice, promote nursing leadership, and increase workforce diversity. So we've all been working on this for a very long time. And together we have built the capacity. We are still building that capacity of the nursing workforce to expand high quality care to more Americans. The new report that I'll discuss now builds on the gains that we've made and seeks to leverage now the capacity that we've been building to advance now health equity. Next slide, please. So as the nursing field built its capacity, we started to ask, to what end? We knew that stark health inequities existed in the United States, and we also knew that nurses have a long history of tackling the many social and economic drivers that affect health. Nurses are the largest and most trusted segment of the healthcare workforce. They work in a range of settings, and they are often the first and most frequent contact with individuals, families, and communities. In 2019, the Robert Wood Johnson Foundation asked the National Academy of Medicine to chart a path for the nursing profession to create a culture of health, reduce health inequities, and improve the health and well-being of this great country. The National Academy of Medicine formed a committee to release a consensus report in 2020. It didn't exactly come out in 2020, I think, as we've all known, because while the committee was in the midst of writing the report, you know what happened? The pandemic happened, followed by renewed calls for racial justice as well. And we realized that the only way for this report to be relevant was to delay its release, to incorporate the lessons of the pandemic, the devastating toll it's taken on nurses, and the ever-growing calls for racial injustice. The report is being released during a critical time in our nation's history and in nursing, when it's clear we must dismantle structural racism to eliminate injustice and inequities. Nursing needs to be at the forefront of creating a more fair and just world, and we need policy reforms to unleash our potential. The report's vision is audacious: the achievement of health equity in the United States built on strengthened nursing capacity, diversity, and expertise. Next slide, please. And we have a polling question. I think I put a couple of polling questions in here. So for some of you, nursing's involvement in health equity may be relatively new, maybe. Others of you may have been doing this work for years. Before I go on, I'd like to get a sense of how much of your current work is spent on tackling what I'm defining as the social and economic drivers of health and advancing health equity. So let's see what your answer might be. Okay, we need to. Okay, so the vast majority are in the middle range, 25 to 50%. Okay, that's great. Wonderful. I need to. Okay, wonderful. So I need to get back, do a little play here. Okay. So great. Next slide, please. So achieving health equity is the most salient issue of our time. And I believe this is nursing's time to help lead the charge. As a country, we have long failed to give everyone a fair and just opportunity for health. We know that health is greatly influenced by non-medical factors that affect communities, such as access to jobs that pay a living wage, safe housing, reliable transportation, walkable neighborhoods, good schools, fresh food, and adequate green spaces. Factors like our race and ethnicity, income levels, sexual orientation, disabilities, and the conditions where we live, including in rural and remote areas, predict whether we will suffer from preventable, costly medical conditions, live shorter lives, and have a fair and just opportunity to be as healthy as possible. Next slide, please. Compared to whites, Blacks and Latinos are more likely to live in neighborhoods that lack healthy food options, green spaces, places to exercise, safety, and have more pollution. This is due to structural racism, defined as a system in which public policies, institutional practices, cultural representations, and other norms of work in various, often reinforcing ways to perpetuate racial group inequity. In Durham, many of the neighborhoods that Black people live in originated in the early 1930s due to redlining, deliberate policies that kept Blacks restricted to certain areas of a community that lacked social and economic resources. That's a prime reason for many of the health inequities in Durham today. The map on this slide was produced by one of the New Deal's most important agencies, the Homeowners Loan Corporation. The area in yellow was labeled definitely declining, and the red was labeled hazardous. Durham is in no way unique. This happened throughout the United States. Next slide, please. These structural inequities and the stress from experiencing racism lead to poor physical and mental health. Blacks and Indigenous people, for example, experience more chronic health conditions sooner, which also puts them at higher risk for COVID. These chronic conditions are the direct result of structural inequities and not necessarily individual choices. Next slide, please. The effects of the pandemic on health have been especially severe for low-income individuals and people of color. Pandemic-related household financial challenges have also disproportionately impacted those who are already struggling and people of color. Low-income individuals and people of color are more likely to live in crowded housing, take public transportation to work, and be those essential workers that we heard so much about during the pandemic. They're also more likely to lack health insurance and be able to access to care. Consequently, they cannot follow recommended social distancing guidelines as easily, and that's why they've been affected disproportionately by the pandemic. Next slide, please. The brutal killings last year of George Floyd and Breonna Taylor by police officers and Ahmaud Arbery by white men while running, and the unconscionable long list of Black and Latino victims who preceded them and came after them, as well as the over 6,600 reports of hate incidents against Asian Americans and Pacific Islanders this past year, underscore the need to adequately acknowledge, confront, and dismantle all systems of structural racism, including within our great profession. We must all commit to a more just future. This is the future of nursing. Next slide, please. The report is intended to meet this moment. It contains 4 key messages and a series of recommendations to unleash the potential for nurses to achieve health equity. These recommendations are the consensus of the committee based on the evidence that they had at the time. We at RWJF are still thoroughly reviewing and digesting the report, and we encourage leaders throughout nursing and healthcare, including those at nursing specialty organizations, hospital and health systems, academic health systems, policymakers, and others to do so as well. So just to tell you a little bit about my role, why Robert Wood Johnson is just getting the report now, as with the rest of the country, when I took this leave from my position at Robert Wood Johnson Foundation to be the senior scholar at the National Academy of Medicine, that put a very strict firewall between myself and the foundation. And so I did my work at the Academy really without influence from any external sources, including the Robert Wood Johnson Foundation. So they just received this report with the rest of the folks. Next slide, please. The report calls on the systems that educate, pay, and employ nurses to permanently remove barriers to allow them to do this work, value their contributions, prepare nurses to tackle and understand health equity, and fully support nurses. The need to dismantle structural racism and diversify the nursing workforce is woven throughout. And I'll discuss each of these in detail now. Next slide, please. Many people in our country cannot access healthcare because they lack insurance, the ability to pay, and clinics or providers in their geographic area, particularly in rural and urban areas. Being unable to access care is inequitable. Nurses can help bridge the gap in access to care through their work at federal qualified health centers, retail clinics, home health and home visiting, schools and nurse-managed health centers, as well as via telehealth. About 70 to 80% of advanced practice RNs work in primary care, in pediatrics, adult health, gerontology, and nurse midwifery. The nurse practitioner field has grown considerably, while the number of physicians going into primary care has remained stagnant or declined. Studies have repeatedly demonstrated that nurse practitioners provide care that is equivalent to care provided by physicians. All sounds very familiar, right, from the first report? Nurse practitioners are 10 to 30% less expensive to employ than physicians and are more likely to care for non-white, non-English speaking Medicare and Medicaid beneficiaries, including those in rural areas, at a lower cost of care. And all nurses can improve the quality of care by managing and coordinating care and providing support during care transitions, such as when people are discharged from the hospital and return home. However, the ability of nurses to practice fully in these other settings is limited by state and federal laws, institutional barriers, number one, institutional barriers, and restrictive health system policies that prohibit nurses from working to the full extent of their education and training. And I really want to stress that when we say permanently remove nurse practice barriers, that means all nurses. Sometimes we pay attention to advanced practice nurses. Sometimes we pay more attention to all nurses across the continuum of care. So that's really the differentiating factor here. Next slide. The report calls for all organizations, including state and federal entities and employing organizations, to enable nurses to practice to the full extent of their education and training by removing regulatory and public and private payment limitations and restrictive policies and practices. This recommendation continues the work of the first report. While we've made considerable progress over the past decade in lifting state level regulations, restricting nurse practitioner scope of practice, 27 states, including North Carolina, still do not allow full practice authority for nurse practitioners. Not permitting nurses to practice to the full extent of their license and education decreases the types and amounts of healthcare services that can be provided for people who need care. Until all nurses are permitted to practice to the full extent of their education and training, significant and preventable gaps in access to care and care across the continuum and in health systems will continue. Millions of people who need health care will be unable to obtain it as readily as others who happen to live in states where nurse practitioner scope of practice is unrestricted. For many people, delays in obtaining care lead to worsening symptoms and disease progression and to greater costs when people ultimately receive care. This is inequitability. Next slide, please. Nurses can advance health equity through their roles in care management and team-based care, preventive care, community nursing, including serving as school nurses and providing telehealth services. School nurses, for example, can bridge health and social needs and fill gaps in access to primary care. They can build relationships with students, connect them with needed resources, and address the root cause of poor health. but 25% of schools in this country do not employ a school nurse. And 35% employ only a part-time nurse, sometimes very part-time. School nurses are also unable to bill Medicaid for services that they provide. The current payment systems are not designed to pay for services that address the social and economic drivers of health and advance health equity. As a result, they often do not explicitly value nurses' contributions to care. Payment systems can enable nurses to make essential contributions to improving care and outcomes for all patients when they support team-based care, improved communication between providers and patients, and proven interventions and strategies that can reduce health inequities. Nursing roles to advance health equity will only be scaled up if they are valued and paid for. Public and private payment systems should be intentionally designed to support and incentivize healthcare and public health organizations to enable nurses to perform these roles. New payment models, such as accountable care organizations, accountable health communities, and value-based payment, can give healthcare organizations the flexibility to address social needs and advance health equity. Payers should also implement a national nurse identifier to facilitate recognition and measurement of the value of services that nurses provide, and nurses should be able to bill for telehealth services so that they can reach people anywhere. This is something that physicians have, and the committee is recommending this for nurses. Next slide, please. Should be on slide 15. The next two key messages are particularly relevant for this audience. We need to do a much better job of educating nursing students so they are prepared to promote health equity and improve the health and well-being of everyone. Students need to be better prepared to understand and identify the complex social and environmental factors that I talked about previously that affect health, effectively care for an aging and more diverse population, engage in new professional roles, adapt to new technology, and collaborate with other professions and sectors, and adapt to a changing policy environment. Collaborating with outside partners of healthcare will be particularly important, including organizations focused on housing, transportation, social isolation, and food insecurity. A strengthened nursing field will be critical as baby boomer nurses continue to retire this decade. I've said this here, and I'll probably say it again, but multi-sector partnerships are really exceedingly important in this new report. You might recall from the last report, we talked a lot about interprofessional collaboration. I'm just going to assume everyone understands and knows that they need to collaborate interprofessionally. We are on to multi-sector collaboration and partnerships. Next slide, please. Let me see. Okay. Nurses can advance health equity through their roles in care management and team. I think I did that. My slides just sort of disappear. Let's go to slide 16. Yeah, okay. Developing a more diverse nursing workforce will be key to advancing health equity. The new report unequivocally states that the nursing field needs to address systemic racism and bias within nursing and prioritize diversity and cultural humility. For too long, the nursing profession has identified as being a caring profession, of course, and maintaining an identity of color blindness, something that me as a nurse, I was always so proud of, that I don't see color, but we know now that that particular frame of mind has really held us back in this new work. Color blindness may have been admirable in its intent, but it was wrong. It unfortunately made us blind to the structural racism that has long existed in the profession. We need to see color. so that we can address the systemic barriers that keep the nursing profession overwhelmingly white and female. Despite decades of emphasizing diversity, the nursing field remains approximately 80% white, even though whites make up 60% of the US population. The gap widens further for nurses in leadership positions, including in academia, with about 90% of nursing leaders coming from white backgrounds, according to AACN and AONL. Nursing students and faculty must reflect the diversity of population and break down barriers of structural racism present in today's nursing education, including in the curricula, institutional policies and structures, and the formal and informal distribution of resources and power. I want you to hear me on that one. All nurses need to communicate and connect with people of different backgrounds and be self-reflective about how their own beliefs and biases may affect the care that they provide. Diversifying and strengthening the student body and eventually the nursing workforce requires cultivating an inclusive environment, recruiting and admitting a diverse group of students, and providing students with the support and addressing barriers to their success throughout their academic career and into practice. Next slide, please. Should be slide 17. We also need to increase the number of nurses with PhDs who focus on the connection between the social and economic drivers of health, health equity, and the overall well-being to build the evidence base in this area. We need to also ensure that PhD nursing graduates can design and implement research that addresses issues of social justice and equity in education and health and informs policy. Nurses with PhDs are also needed to teach the next generation of students. I know that this audience includes a lot of doctoral nursing students, including DNPs, and I'm thrilled that you've chosen that path, but we need to shine the light on the PhD because of the inequitability of those degrees and the need for the PhD. We need more of you. Increasing the number of nurses with PhDs will require financial resources, including scholarship and loan repayment opportunities, adequate numbers of expert faculty available to mentor, and curriculum revisions that focus on equity. All PhD graduates should have competencies in the use of data on the social and economic drivers of health as context for planning, implementing, and evaluating care for improving population health through large-scale data application. And they should be able to design and implement research that addresses equity in education and health and informs policies, as should those in the DMPs. Next slide. Right now, content about the social and economic drivers of health, health inequities, and population health are not, the committee found, well integrated into undergraduate and graduate education. I'm not saying this is true at UNC Chapel Hill, but in other places, yes. Nursing education programs should ensure that nurses are prepared to address the social and economic drivers of health and achieve health equity. Schools of nursing need to integrate these concepts and competencies throughout the coursework. Schools should also expand community learning opportunities, substantive education in the community, such as schools, workplaces, home health care, public health clinics, and telehealth settings. Allow nursing students to learn about the broad range of care environments and to work collaboratively with other health and non-health professionals. Students need to actively engage in experiences that will expand and diversify their understanding of nursing practice, prepare them to care for diverse populations with empathy, and allow them to build the necessary skills and competencies to advance health equity. Next slide, please. Nurses need to feel healthy, well, and supported in order to care for people and to advance health equity. But the pandemic has taken an unprecedented toll on the nursing workforce. Before the pandemic, many frontline nurses were understaffed, overworked, and burned out. Many worried about bullying and violence in the workplace, and of course, we still worry about that. Many also care for children or elderly relatives outside of work. So all of these stresses have been exacerbated by COVID-19. Of the more than 12,000 nurses participating in a December 2020 survey conducted by the American Nurses Foundation, Pulse of the nation's nurses, most share they are currently experiencing a higher likelihood of depression, anxiety, and distress from when they were surveyed in spring of 2020. During the spring administration of the survey, 50% of nurses indicated they felt very overwhelmed, and then those feelings intensified to 72% later on. Next slide, please. For over a year, nurses have risked their lives and the lives of their loved ones to care for others. They've cared for multiple critically ill patients at once and served as additional support when their families couldn't be physically present. They've used their own iPads to set up calls between patients and family members to say goodbye. And then they've stayed with their patients so they don't have to die alone. Other nurses have quickly moved floors and have had to rapidly adapt to caring for large numbers of COVID-19 patients, often without adequate training. Nurses are working long shifts, sometimes without the personal protective equipment needed to stay safe, although I hope that's certainly not the case now. Over 550 nurses have lost their lives to COVID, a disproportionate of whom have been nurses of color. Some nurses who have spoken up to demand adequate protective equipment have lost their jobs, which is an outrage, unbelievable. They've also faced stigma from the general public. What the workforce has been through is unjust and unsustainable. One of the main imperatives from an ethical advocacy and policy standpoint in the next decade will be to improve nurse well-being so that nurses will be able to provide high quality, safe care and to continue to care for patients, families, and communities. And that includes tackling the systems, structures, and policies that create workplace hazards and stresses that lead to burnout, fatigue, poor physical and mental health among the nursing workforce. Next slide, please. This pandemic has also been challenging for nursing educators and students, many of whom I'm talking to right now. Faculty have had to adopt new teaching strategies in a short period of time and rely on simulation-based education experiences to replace clinicals. Many programs have had difficulty in ensuring that students have had sufficient hours of instruction, training, and clinical practice. Students without computers or internet access have raised issues of inequities in nursing education. Before the pandemic, nursing students reported feeling stressed out, exhausted, and disengaged, and many of these feelings have been exacerbated by the pandemic as well. Educators need to ensure students' well-being and to give them skills to nurture their well-being during their careers. We need to create a culture where well-being is integrated throughout the curriculum in visible and meaningful ways. For example, the Compassionate Care Initiative at the University of Virginia School of Nursing supports well-being throughout their entire coursework, resiliency activities for students, workshops, retreats, meditation, and yoga classes. Next slide, please. To fully support nurses, we also need to address and eliminate racism in our workplaces. Nurses of color repeatedly report experiencing discrimination and bias within their work settings. All nurses need to create a culture of equity in their workplaces. Our workplaces should reflect the patient population that we serve, and everyone should practice cultural humility and be aware of their biases. Our workplaces need to recruit, retain, mentor, and promote nurses from underrepresented backgrounds. We need to advance nurses of color to leadership positions where they are sorely underrepresented. Next slide, please. The report includes a number of recommendations to fully support nurses. The main one is that by 2021, nursing education programs, employers, nursing leaders, licensing boards, and nursing organizations should initiate the implementation of structures, systems, and evidence-based interventions to promote nurses' health and well-being, especially as they take on new roles to to advance health equity. And nursing education programs, for example, can integrate content on nurses' health and well-being into their programs to raise their students' awareness of their importance and provide them with training and support as they transition to care. Next slide. So I also want to take note that the report calls on all the nursing organizations to work together to create a shared agenda. They should identify priorities for education, practice, and policy, and develop mechanisms for leveraging existing nursing expertise and resources. Creating a shared agenda will focus efforts and ensure that all nurses are prepared, supported, and empowered to address the social economic drivers of health and to eliminate health inequities. The report asks nursing organizations to take actions both within their organizations and across organizations. I wanted to point out something here. This is somewhat of a typical recommendation where we're asking all nursing leadership organizations to work together. The unique one about this in particular is, in the Tri-Council, made up of the five major nursing organizations, including ANA, NLN, et cetera. They're used to working together. They work together as a council and they work together well. But what this recommendation is espousing is that the Tri-Council really work now with the Council of Public Health nursing organizations. That council made up of a number of public health entities, including school nurses. The nurses in this particular sector are used to working in the field of social determinants. They understand the language, they're seeped in this work. And so drawing upon that expertise, the Federal Nursing Council, I saw Dr. Peggy Wilmoth on this call as well, a proud Army nurse. This is a council that represents the military, armed and unarmed services, the Army, Navy, Air Force, Public Health Service, Veterans Administration, et cetera. There's 7, like the American Red Cross. How could I forget my American Red Cross? So who's better to really understand and have expertise around public health preparedness and disasters? And then finally, the all-important National Coalition of Ethnic Minority Nursing Associations. So these are the organizations that we're asking to work together to leverage each other's expertise. Next slide, please. The report offers many additional ways for individual nurses to get involved in advancing nursing equity. For nurse educators, you can see some ideas on this slide, including developing competencies to advance health equity, initiating dialogues about racism and inequities in your classrooms, and mentoring and sponsoring students from underrepresented backgrounds in nursing. Next slide, please. There are many ways that individual nurses in practice can get involved in advancing health equity, including modeling behaviors that promote a culture of diversity, equity, and inclusion, getting involved in advocacy efforts, a wonderful thing to get students involved with, being aware of your own implicit biases, investing in your own health, and identifying and disseminating best practices to promote equitable care. Next slide, slide 27. Here are some examples of how nurse leaders can get involved in advocating for organizational policies and structures that support nurses and promote equity. Leaders can shape the day-to-day work life of nurses, setting the culture and the tone of the workplace, develop and enforce policies, and serve as role models of well-being. Next slide. Nursing research is vital to advancing health equity. The report notes that strengthening and diversifying the nursing workforce of the future and fostering nurse well-being to enable nurses to advance health equity will require a robust and rigorous evidence base. The report calls on various government agencies and foundations to bring together representatives from nursing, public health, and healthcare to develop and support a research agenda. And you'll find some of those ideas for research in the report as well. This includes proposing, evaluating, and scaling evidence-based practice models to advance equity, identifying multi-sector team approaches, reviewing and adapting evidence-based approaches to diversifying nursing schools and faculty, determining evidence-based education strategies for prepping students to eliminate structural racism and implicit biases, and improving the use of IT infrastructure to identify and integrate health and social data. The report includes a table of research topics, as I said, at the back of the report, so please check that out. So the last polling question. This report covers a lot of grounds, and I'm curious to see what has resonated with you. Of the 4 key messages listed on this slide, which of these have resonated with you? And you do have the option of putting all of the above. And as you're thinking about this question, I'm just about at the end of this presentation. And as we go to a chat function and ask questions, I'd like you to begin to put in the chat function and call out as well. What kind of resonated with you, depending upon the position that you've been in? What about what I've said has resonated with you? This report is very, very long. There's a lot to digest. I encourage everyone to really read it and make it your own. So Andrea, you can let us know. There it is. Okay. Okay, so that's good. So really, the one that stands out is preparing nurses to tackle health equity. Yeah, that is like the main sort of message here, isn't it? Okay, great. That's wonderful. All right, so last slide. Answering the call. The next decade offers tremendous challenges and opportunities for the nursing profession. More than ever, we need to tap the full potential of all nurses in every setting so that we can achieve what our country needs for everyone, no matter who they are or where they live, to be able to experience good health and well-being. New and established leaders at all levels and all settings are needed to lead change that results in meeting social needs, addressing the social and economic drivers of health, and ultimately achieving our goal of health equity. My hope is that all of you will answer the call to create a world where everyone can experience the best possible health and well-being. And with that, I thank you, and I am most happy to take your questions and hear really more about what resonated with you.
Thank you so much, Sue. Wow, your
That was
passion, well, your energy, enthusiasm, passion for this report and the message, but most importantly, for the potential of nursing and nurses to change our future and to change the future in our country is really phenomenal. So thank you for being here today and delivering that message. I'm going to encourage folks to please put your questions in the chat box. I see Dr. Dean Paragala-Montano on the Zoom with us.
Just want to say thank you, Sue, for a wonderful report. And it's so exciting that, you know, we're really charting the future here. And I hope everything, you know, works for us. We deserve it.
Great.
Yes, indeed. I want to encourage folks to please put your questions in the chat. While we're waiting for the questions to come in, Sue, I'll just throw out a few to you.
Okay.
You know, I know this is a question that you may not want to get asked, but I'm going to ask it anyway. No, if you had to choose one thing from this report, one recommendation, what the one you want to emphasize here, what would that be?
You know, I would say this. There are, you know, we kind of cheat by saying there's just 9 recommendations in the report, but there's like 54 recommendations, but 9 very big overarching recommendation areas. And I will tell you, Cheryl, that what I'm doing is I'm encouraging everyone to sort of take the report, read it, skim it, look at the recommendations, look at your particular areas of interest, the education chapter, the leadership chapter, paying for care, and really, really trying to understand what makes sense for you and those who work with you. So I think the answer to that is going to be different for everyone. But if I had sort of a message from Sue Hassmiller, from my heart and from my soul, I would say, honestly, with all of the work, you know, and I've been at Robert Wood Johnson for a very long time, and we've been working in this health equity sphere. There's a lot of people working on health equity now. That's all we're really doing at the foundation now. And with all of this work around health equity, government agencies, other foundations, health systems, you know, nurses have got to hear this and be involved and be leaders in this area. This is the time to get involved. This is the inflection point, as I said in the beginning. So nurses need to step up, understand their own biases, call out. And here's the other thing I would say. This calls for nurses to be, let me see how to put this, to be very kind and respectful with one another now, but understanding that it's not good to ignore anymore. We need to have crucial conversations, and as leaders, we need to bring in those, intentionally bring in those conversations. And you know, we're all learning. Some of us are learning more than others. So be respectful, be kind, be patient, but be action oriented, because we've got to do this as nurses.
Thank you. I'm getting a few questions now, and I think some of them are going to Andrea. Andrea, just shoot them on over to me. Thank you very much. Here's one, Sue. Why are there barriers to nurses practicing up to their education and training? What are your thoughts on that? And I know there are some recommendations in the report about how we might remove those, but being in a state, as you called out, where scope of practice regulations are restrictive, why do these barriers exist? And what are any particular pieces of information you can share with us to help solve them? That one comes from Barbara Slavinsky.
Yes, or you really want me to say? So
we're being recorded.
As I said in the report, when we talk about practice barriers being lifted, there are regulatory and legislative barriers, but there are institutional barriers as well. I think we all know, I think most of us on this call know that legislative barriers are very tough. We're not at the tipping point. There's a very good reason why this recommendation is in this report yet again, because we're not at the tipping point and we need to be. You know, there are others in our health professions that still believe that nurses should not practice to the top of their education and training, that the hierarchy should be alive and well. And there's misinformation too. I have realized over the years in working on this issue that, which is why I really coach nurse practitioners never to use the word independent, because that word is used against us with legislators. When our physician colleagues come to legislators and say, well, you know, we're collaborative, but others want to be really independent, and that's not safe care. So we have to be careful with our language. We have to continue to get out the stories of consumers being helped, the access to care. And I'm going to end on another note with the partnerships between schools of nursing and practice partners. So institutional barriers are alive and well. So I talked about legislative barriers, but really the barriers that prevent most nurses and nurse practitioners from practicing to the top of their license, education and training, are those institutional barriers. So I would really admonish, call out leaders, faculty in schools of nursing to partner with their practice partners to say, look, we're teaching our nurses to do X in our programs. And when they get out and work in your institutions, they can't do X. So can we talk about how we reduce some of those institutional barriers, both for advanced practice nurses and for registered nurses that work for everyone in a more equitable way?
Thank you, Sue. I couldn't agree more. That relationship between academia and practice and working hand in hand and together, building those academic nursing partnerships is essential. There are several questions in the chat about doctoral education.
Okay.
So I'm going to just throw a couple of them at you. One is from Aletha Harper. She would like to know your thoughts on nurses with EDDs and nursing education. And then there's one from Ilsa McKenzie Henry, and she mentions the discussions around PhD and DNP nurses. What is your stance on the EDD? Do you feel those specialty trained nurses can be as impactful as the two that have been magnified?
Absolutely. Yeah, I think we, nurses who have expertise around education are absolutely very valuable in our system, especially in academia. Absolutely. And again, I said it during my presentation that, we have a dashboard. If you go to the Campaign for Action, my Future of Nursing Campaign for Action, we have special dashboard indicators around some of the recommendations from the first report, one of which is doubling the number of doctorates in our country. We know that we have not only doubled the number of doctorates, but far, far exceeded our wildest expectations. And how we have done that has been through the DNP. I am thrilled with that. I am so glad. But the purpose of me pointing out, not me, the committee, pointing out the need for the PhD is because that's such a degree that's lagging. Not as many people, far, far, far fewer people are coming into this degree. And we need those scientists and researchers to really do the work needed around health equity. So that's the emphasis there. But we need everybody.
Mm-hmm. And I'm going to ask a question from Kathy Madigan, our CNO and partner extraordinaire at UNC Healthcare. But first, she thanks you for the great presentation. She asked a related question, and that is, you mentioned the role of the PhD leader in the process. She'd like for you to comment on the contributions of the DNP prepared leaders. And I think you kind of touched on that in your last.
Yeah, I have. I think I have. I mean, marvelous contributions. We wouldn't be where we are in this profession without that degree. And many degrees differ, DNP's policy, leadership, but absolutely valuable.
And I will actually say from my own experiences as a researcher, I rely on my DNP colleagues to actually lead the way, take the message, implement, and really take up much of the work that I do and my colleagues do. I have a question here from Allie Tran. I do believe you know Allie, who's a Robert Wood Johnson Future of Nursing Scholar.
I certainly do. Yep.
She said, really important recommendations. Thank you, Sue. Can you share your reflections on the progress towards and or met in the previous Future of Nursing report? For example, Bsn Education Rates, and how these inform the report's recommendations.
I know that we're at the 2 o'clock hour. I will just say this. We've had a number of successes. 80-20, we're not to 80% baccalaureate by 2020. We will get there with the retirement of more associate degree nurses and the more RN to BSN program. So we will get there. It's still a very, very important recommendation. We carried that one over into this report for good reason. if anything ties to health equity, if we felt that it really linked to health equity, we found a way to make a home for it again, like scope of practice 80/20. 10,000 nurses on board, we exceeded that one. We had one on interprofessional collaboration, which we have met. Let me see, diversity, we need more work, right? So diversity is another dashboard indicator that we are still tracking. We'll probably create some new dashboard indicators around this report. So that's sort of a synopsis. Great successes. How great that Robert Wood Johnson Foundation has supported this work and in collaborations with AARP all of these years. I'm so very privileged. And with everyone in the field, all of you on this phone, educators, clinical leaders, so many people working to get those recommendations adopted. Now we have a new set to work on.
Sue, it is a few minutes after 1. We have you for a few more minutes. So I'm gonna,
Okay.
we have a question here from Dr. Ernest Grant, who you know as the president of ANA. He said, Sue, thanks for presenting a wonderful and exciting report. I'm happy that a lot of work has been and is going on with some of the recommendations. Looking into the future, if the recommendations are not implemented, what would you think the profession would look like? Would we lose our autonomy over practice, et cetera?
If we didn't implement these recommendations?
Yes.
Wow, what a question, Ernie. I mean, first of all, we would be way behind the times. We would be doing an enormous disservice to the people we care for, the patients and the clients and the people we said we came in this profession to care for. I mean, it would be a terrible disservice. Schools of nursing, wouldn't be on par with schools of medicine and other schools that are working on these recommendations already. So many people in the field are working on these issues. We cannot afford to leave nursing out of this equation. That's really the main point. We are working together, I want to say for the first time in this country on these issues, certainly in my lifetime, in a very intentional way. And I'll be damned if nurses are left out of this equation.
Hear, hear. Thank you. This question comes from Dr. Norma Culler. She's a member of one of the 5 organizations in the National Coalition of Ethnic Minority Nurses Association.
The Hispanic non.
Yes, representing over 1 million nurses who are Latinos, Black, Asian, Filipinos, and Native Americans. Thank you for mentioning our organization. We work diligently to promote health equity and have been doing this for over 30 years. You do have to be a minority or you do not, I think she's saying you do not have to be a minority or an underrepresented group to join, just
Right.
interested in our common goals of eliminating equity in healthcare.
Yeah.
So that was very wonderful recommendation from the report.
Yeah, yeah, yeah.
Here's another one. This was sent without a name. The person said, I do think we need to rethink the perspectives of Florence Nightingale being the foundation of nursing practice. I am an African American, and I often wonder, because of the era, there must have been some Black people assisting Florence. I think we need to emphasize other races that have contributed, for example, the first Black nurses. And somebody just chimed in and said it was submitted by Geraldine Jones.
Absolutely. I mean, we talk about that in the report. Florence Nightingale had extraordinary contributions, and sometimes, and it's not to make excuses for, but history was written at one point in time. And we have the opportunity now. That's what I meant by saying this is an inflection point for nursing. Okay, so Florence Nightingale was in that time. We are in a different time. Schools of nursing should, of course, bring in other representation of nursing leadership. I mean, for me, the one of the greatest mentors I ever had in my program at George Mason University was Dr. Hazel Johnson Brown, who Dr. Wilmoth knows, the first African-American general in the Army Nurse Corps. And I mean, she taught me so much, but we are in a different place now. There are no excuses after what we're living and this report to do anything but embrace it and take action.
Okay, so you hear some of the comments and questions coming from this group. What have been the reactions to the report thus far more broadly? What are you hearing from the public and the community?
You know, I think people have different, as they listen to presentations and as they may read the report, we're all individuals. We all have our own bodies of work. So different things come out. You know, if you're an APRN, you may have issues or questions around that, and you may want to take on that. You know, heads of PhD programs. So there are a lot of individual reactions, but I will tell you one. I want to follow. I did a presentation this morning. I have goosebumps just listening, just remembering now what this one woman said to me. Dr. Martha Dawson, some of you know her. She said to me, she said, Sue, on a presentation, she says, I have been waiting for this report for 44 years.
Wow, very powerful.
And
Many
then
of us have
another
been
on the
waiting a long time.
And then another on the presentation, Dr. Rita Ray, she's the lead for our Mississippi Action Coalition, a Black leader there, who some of you may know as well, said, thank you for bringing in the issue of colorblindness and admitting that you were colorblind. That has been a great disservice to our profession. And thank you for acknowledging that, learning and moving on and helping others learn. So, I mean, this is a process for all of us. That's why I say, I hope everyone can be on this learning journey, understand, be kind, be respectful, but don't hold back and take action. This is a time for action advocacy.
Very good. And you've got us ready to do just that. So I'm looking at my notes here because I have quite a few things on it. Several of your comments around the value of nursing, and we see many things in the literature and even in the press about the value of nursing, and at no time probably has the value of nursing been more evident to the public. Talk about how we really change the system to value nurses. I mean, I think the system, you know, does value nurses. There's no question that nurses are valuable, but we continue to say that the contributions of nurses need to be valued. And so I'm trying to think more deeply about how we actually go about doing that.
Yeah, well, I think you have to do things that are spelled out in the report as well. You know, the chapter on paying for care, when I talked about a nurse identifier, you know, if nurses had an identifier number, they can not only be held accountable for their care, but they can be recognized, and you can link the care that nurses give to that nursing identifier number. I'm gonna randomly kind of spout out what's coming into my head.
Good.
So that's one way. I really believe too that nurses need to take very, very seriously the notion that they be on boards and committees, because, you know, as we all know, the world is run by those who show up. And to be on boards and committees that have influence over policies that affect these social determinants, like in housing or food or access to care, even accountable care organizations. Look at the power that those accountable care organizations have over how healthcare is organized and delivered and who gets to do it and what the rules are, right? To have nurses on those kinds of committees that have influence, that's what we really need to do. So those are just a couple of things that come to mind. And never give up. Never give up.
Well, you're a wonderful example for us that not to do that, right? Here's a question from Betty Martinez, and it's a question that I have written down as well. She says, thank you for presenting the report in such an exciting way. What do you recommend for newly graduated nurses to do to start making a difference as new nurses, grad or undergrad? We have a great deal of energy to start our career paths, but what should we do initially to get more involved to make a difference? Thank you. And thank you, Betty. That's a great question.
That is a great question. So, it starts with where we are now, having the report, understanding what we need to know. We need to know about what causes illness, care in our country, or illness, the social determinants. We need to have that awareness. We need to have an awareness of our own biases. But then as we enter into systems, we need to have our antennas up. We need to have antennas up about all of this that's in the report. Is this an environment that is supportive of nurses? Is this an environment that if I notice, or if I'm caring for patients that has food insecurity?
Because what's the point of having
excuse me, somebody needs to mute themselves.
Okay.
Okay, I think we got it.
So yeah, so have your antennas up, and if you're working in a work environment that doesn't support nurses addressing these things, like I'll give you an example. Okay, so I made a site visit 2 summers. Okay. Have I don't know if I've been muted.
Sorry.
I think we're all muted. Anyways, have your antennas up. I don't know if I'm repeating myself. I apologize. Have your antennas up. So I made a site visit to Rush Health 2 summers ago. And this is an example of what I mean by a system supporting nurses addressing social determinants. So at Rush, they have built into their electronic health system, every single person coming into that system, whether through walk-in or emergency room or however, clinics, they all ask the same amount of questions around social needs and social determinants. A nurse does that intake, and if a patient, for example, has been found to be food insecure, bingo, the red button gets pressed and resources are availed in that system. So nurses can, it's really important that nurses understand this work, be involved in those crucial conversations. If you're a magnet facility, or even if you're not a magnet facility, join committees, raise your hand to say, I know, there's a very important report. And I'd like to talk with leadership here around how we look at the policies, do a review of the policies of our work environment, and sort of make changes. So there's a lot as a new nurse you can do. I know that's a big bite to as you're walking in, you're just got to try to take care of people. That's your first nursing job, I understand. But just have your antenna up in the beginning. Have your antenna up, understand where people come from in the community. I'm a big volunteer. I understand when I say that I volunteer that not everybody can or wants to. Nurses have very busy jobs, but it's a great way to know your community and know the other sectors in your community. and sort of gather partnerships along the way. So that was, I hope that was semi-coherent, and I realized I was muted in the middle of all that, so apologies.
It worked.
I think we all got muted when we heard voices come in.
It worked. You just said the word sectors. And so I want to go to a comment you made in your presentation about, we really need to, we should have interprofessional down, but so now the next source of collaboration really is multi-sector, going outside even healthcare. To develop relationships and collaborations. Can you talk a little bit more about that? You've been a proponent for a long time. Speak more about that, if you will.
Yeah, I think I really talked about it. We can't leave interprofessional in the dust. Obviously, we still have a lot of work to do with our physician colleagues, social workers. This is a big space, of course, for social workers to work in. For us to have tightly woven collaboration between us is really critical. But now's the time to understand that we need to look outside of the profession. This report is about leaving your comfort zone behind. In so many ways, this is about leaving your comfort zone behind, having those conversations, really understanding yourself and what you bring to your clients and your patients is so critical. How you operate, how you lead in a work environment, how you role model is all important. But if we're really going to do the work of health equity, we need to begin to understand the organizations that are really central to that work. And there are a lot of organizations, if you want to know who those organizations are. One way is you can scan around the Robert Wood Johnson Foundation. We work with a lot of national health equity organizations, or those organizations that are doing a lot of health equity work. In your communities, your state, you can sort of plug in your state and put in the words health equity organizations and just do kind of a scan. But I know, just beginning to network, knowing what's out there. And I'm telling you, we not only need to know what they know, they need to know what we know. So I call it working both sides of the fence, encouraging nurses to be more involved with other sectors and encouraging other sectors to really understand what value nurses bring to their table.
I really appreciate that. And I appreciate the fact that we really need nurses, although we're studying in nursing, but to really learn from other disciplines, within and outside of healthcare. So I think that's really important.
Yeah, and in doctoral programs, DNPs and PhDs, there are committees that oversees the doctoral work, ensuring that, there's so much that can be done around these sectors, ensuring that at least one of those committee members is from another sector, really guiding students. First of all, having faculty, recruiting faculty that look like the people we serve, I'm going to say obviously, and then recruiting faculty with particular knowledge in this area so that you can begin to then recruit students that are interested in this and really foster that culture of studying health equity. Yeah, and then having experts from outside of nursing on those committees is really critical.
So I have just one final question, and if there are any other chats, please, any other burning questions out there, please feel free to ask them, and I'll make sure pass those along. But Sue, 14 months into a pandemic, I was really pleased to see all of the effort and attention put on nurses' response to and involvement in addressing issues that arose during the pandemic. Talk a little bit, and you, from your perspective in the Red Cross, talk a little bit about where we might need to go in preparing nurses and other health professionals for the next pandemic or the next health crisis?
Yeah, a couple of things come to mind. I would say that we just need to here's one there's one thing institutions can do. I know I'm on the board of Hackensack Meridian, and what they did was they did a major system overhaul and an identification, if you will, of some of the policies that went by the wayside or were relaxed or were changed during the pandemic. And then they did a review of what needed to stay changed, what needed to stay relaxed, what really worked. So they made lemonade out of lemons, and they had that report, and it's a public report now. So you can, I would recommend all institutions, schools of nursing, healthcare systems do this. I think on the Kaiser Family Foundation, we see some documents that have to do with some of the, positives that came out of the pandemic in terms of policies and regulations. I think for schools of nursing, we need to take stock. I know some nursing schools do require nursing students to get certified in at least a smaller course around disaster preparedness, which at least put your antenna up of how important this is. We just need to understand the lessons of this pandemic, the support that nurses needed along the way. And yes, nurses got a lot of visibility. They really have, but they got a lot of visibility. It's good. I'm going to say it's good. They got a lot of visibility around their care, right? About how they cared for people, how they were there with the iPads and were there when people died, and such important things that I would never, ever want to minimize. But that's still in people's heads about what nurses do. That's a good thing, but we have to build on that, because nurses also, create, implement, change policies. They're also on boards. They also do research. They're leaders of health systems. So the public image of nursing is great, but it's still in that limited box. We need to take it the next step.
I agree. And actually during the pandemic, nurses were also exposed to a lot of other things that weren't as positive, like violence in the workplace and other things. So we have so many things, as you said in your remarks, have been laid bare by the pandemic.
Mm-hmm.
This is gonna be our last question, and that is, it comes to you from Maria Milagros Nusel Rivera. How do we promote more nurses of color in leadership roles within healthcare organizations? I do not see that happening a lot. How do we help nurses of color become nurse executives? I'll turn the floor over to you.
One word comes to mind: intentionality. If we're not completely and positively intentional on paper, in thoughts, in culture, intentional in doing this, it will surpass us, bypass us once again. So we have to do that. The other thing that comes to my head is that I know there are a number of programs in our national nursing associations, AONL, AACN, many of the minority nursing associations have special programs, leadership programs to really help with this effort. I would say for those of you who really want to be involved and make this effort even a bigger push, then work with one of your nursing associations and make it more visible in academic settings and workplaces. Point it out again, unless you're part of the decision-making structure, it's a little bit harder, especially in huge organizations. So being at the table really makes a big difference.
Thank you so much, Sue. I think that's a good point to end on. Be at the table and be intentional. So thank you very much. I want to thank our audience for joining us here today. I'm going to give you 5 minutes of your afternoon back. Sue, I'm going to keep you on for a few more minutes, but I just want to thank everyone for joining us. Dean Paragala-Montano, if you want to say a closing remark, I open it to you.
Thank you. Thank you so much, Sue. This has been fascinating. I mean, the questions have been great. I think it really excites us to see, our people thinking about, what are the implications and how do we move the needle? I mean, like you said, this has to be action. It's not enough that we repeat ourselves over and over what we want to do. We need it to happen and what we can do in each one of our locales and, nationally and globally to really promote these recommendations, which are truly applicable, at the global level. So I thank you. I thank the committee for great work. And we have a lot of work ahead of us. So let's do it. Thank you so much. And thank you to all the participants for being here and sharing your thoughts. Thank you.